Good morning, everyone. As we have a quorum, we shall now commence the meeting in public session. Apologies have been received from Senator Annie Hoey and Senator Francis Black. I would now like to introduce our witnesses who will now provide an update on the rollout of the EU Digital COVID Certificate DCC. Ms Liz Canavan, Assistant Secretary-General, Department of the Taoiseach. Mr David Gilbride, Head of Immigration Service Delivery, Department of Justice. Mr Maurice O'Connor, Assistant Secretary-General, Department of Health. Mr Derek Tierney, Assistant Secretary-General, Department of Health. Mr McCallion, National Lead COVID-19 Vaccination Programme, HSE. Mr Fintan Towhey, Assistant Secretary-General, Department of Transport. Mr Barry Lowry, Chief Information Officer, Office of the Government Chief Information Office. And before we hear your opening statements, I need to point out to our witnesses that there's uncertainty of parliamentary privilege will apply to your evidence from a location outside of the parliamentary precincts of Leinster House. Therefore, if you're directed by me to cease giving evidence in relation to a particular matter, you must respect that direction. Just before I call on Ms Liz Canavan to make your opening remarks, you have 5 minutes. Just on behalf of the members, we've just received the 70-page document from yourselves. I think it's very disrespectful to the committee members that we're only receiving this document at the last minute. I don't think it gives justice to the information in the document, and it makes it very difficult for members to ask questions. They're probably going to be asking questions that are already in the document itself. So maybe just note that, and it's bad form, and many of the members have expressed dissatisfaction just a couple of minutes before we start the official meeting. So Liz Canavan, please make your opening remarks. Sorry about this, members. We seem to be having IT problems.
Can you hear me now, Chairman?
I can hear you. We can't see you.
Sorry, you there? Is that okay now?
You're grand now. You're
okay.
Very welcome.
Sorry about that. Okay, so first of all, just to thank the Chairman and the committee members for the invitation to meet with you today, and indeed the late arrival of the opening statement. It's a very fast-moving situation, so we are trying to give you the most up-to-date information on the situation. So my apologies for that. That was on my end in terms of trying to get the latest picture for you. I'm here this morning in my capacity as chair of the ad hoc subgroup of senior officials on COVID-19 that the government agreed to establish at the end of May, and I'm not going to introduce my colleagues because you've already done that. As you know, the EU Digital COVID Certificate regulation was developed to facilitate safe, free movement of citizens in the EU, and the regulation became directly applicable to Member States on the 1st of July. And on the 29th of June, Ireland joined the gateway, meaning that certs issued in Ireland are recognised by authorities in other EU states, and that Ireland can verify digital COVID certs for travellers arriving from other EU states. On the 1st of July, go live as a pilot run, we issued initial DCCs, including the digital signature, attesting to the fact that it was issued by an authority here in Ireland. And on the same day, we had a team working at airports and airports verifying QR codes. And on the 9th, we published our travel rules, and we were one of only 4 countries to do so at that stage. So the cert is now fully operational, and since Monday the 19th, the government advisory on non-essential travel has been lifted. Passengers are encouraged to check the public health advice and restrictions in place in the destinations they're travelling to, and the public health measures in place for those arriving in Ireland will depend on their vaccination, recovery status and travel history. However, if you're not vaccinated, the public health advice remains to avoid high-risk activities, and that includes international travel. So just in terms of our approach, the implementation of the digital COVID cert cuts across a number of government departments and agencies, and the role of the group and me as chair has been to develop a unified project to coordinate respective efforts of colleagues around the system to identify the potential risks and gaps and progress mitigations on alternative solutions. Thanks to my colleagues, we have made significant progress to date in implementing what is a large and complex programme that has required delivery in a very tight timeline. And on behalf of my colleagues, I want to give you an overview of the approach we adopted and the progress to date. Our primary focus was to fulfil our EU obligations in a robust and effective way. And in doing so, we had to be mindful of developing the cert in a way which provides the greatest assurance in line with data protection as regards what is sensitive personal information. So first of all, considering the pressures on the HSE and in particular the ICT teams following the cyber attack, the Office of the Government Chief Information Officer undertook to do the certificate generation process on behalf of government. So digital COVID certs for vaccination recovery are being produced by the OGCIO using data provided by the HSE, and vaccination certificates are being pushed out. And this approach has enabled us to get certificates out to as many people as possible, as quickly as possible. In respect of vaccinated people where a verified email address is available, the vaccination certificates have been sent by email, and where no email address is available, they've been posted out to home addresses, mainly those vaccinated through GPs. And to date, over 2.1 million vaccine certs have been issued by mail, about 1.15 by email, and 950,000 by post. And as additional people become eligible, these will be issued automatically shortly after their second vaccination and approximately 5 days later. While there is insufficient contact information to send out a cert, the call centre is available where a cert can be requested once a person's identity and eligibility have been verified. So it's important to say that the certs are generated based on the available information, and in terms of the data to support certification, this is the purview of the Department of Health and HSE. So again, just to point out, the HSE has multiple data sources for vaccine and data recovery, and the data quality is varied. And extensive data quality work was carried out in advance to ensure sufficient and fully accurate information was available, both to support the cert generation, but also the issuing of the certs. There will be circumstances where information needs to be updated on certs, and this can be done through the call centre. Significant work on data relating to persons who've recovered has also been undertaken. Given the quality of the data and the relatively small numbers involved, we decided to provide recovery certs on a request basis rather than the push basis, and this will allow us to ensure that we can complete missing data fields, authenticate identity, and ensure address and email for issuing of the cert are up to date and accurate. Recovery certificates will also be available on request through an online portal, which we hope to open later this week, or through the call centre, subject to verifiable evidence of recovery from a prior infection within the previous 180 days. So the digital COVID certs for negative tests will be provided through private operators who meet minimum entry requirements. To provide citizens with an EU digital COVID test certificate, COVID-19 testing providers of tests will be provided with access to the EU digital COVID test certificate service operated by the OGCIO, and access to this service will allow test providers to generate EU digital certs for all negative or not detected tests in line with national and EU regulations. Approved access to the system is contingent on test providers being compliant with relevant regulations and certain standards and obligations, and these are all detailed in the standard operating procedures. So prior to receiving access to that system, providers are required to review and digitally sign the standard operating procedures. A small number of private operators have already signed up to provide DCCs, and further information on who these providers are will be available shortly. In terms of the COVID Tracker app, an upgraded version of the Tracker app now allows people to upload their cert, whether they received it by paper or in a PDF, to a wallet on their phone. And the Tracker app serves as a pandemic response tool, as you know, and carries a number of functions, but these are independent of one another, and it is possible for people to disable other features and use the Tracker solely as a digital wallet for their DCC if they want to do so. It is worth emphasising that the issue of privacy has added to the complexity of the task and has been given paramount importance by everyone working on the project. Data governance has been the subject of ongoing engagement with the Data Protection Commission to ensure the process is fully compliant with GDPR regulations and the requisite data controller and data processing agreements are all in place. Discussions are ongoing between European Commission and third countries with a view to facilitating interoperability and mutual recognition of certificates. And the first country to achieve an equivalency decision was Switzerland on the 9th of July. It should be noted that the EU Digital COVID Certificate is not a travel document and possession of the cert will not be a precondition to exercise your free movement rights. Therefore, travellers who do not have a DCC can provide other verifiable forms of proof of vaccination or valid negative test in Ireland. You will be aware of media reports in respect of travellers who have travelled to EU countries without a digital COVID certificate. The Department of Foreign Affairs has been liaising with authorities and has been in direct contact with a number of affected citizens. In respect of Malta in particular, it is our understanding that Malta has indicated that the GCC is a requirement on the Reopen EU webpage, and they have indicated that they will not accept handwritten certificates. But the situation underlines our advice to all travellers. It's essential that they familiarise themselves with the inbound rules and process requirements of the country of destination. A great deal of information is available online, and we're urging anyone who is travelling to check the online resources before they finalise their plans. In terms of passenger locator form, passengers entering Ireland must fill in a form before they arrive in Ireland. Failure to do so is an offence, and the COVID passenger locator form is now an online form. As of the 12th of July, carriers are obliged to check for a completed EPLF form before allowing passengers to board or embark. Through enhancements to the electronic passenger locator form, which have been finalised this week, travellers will be required to make a statutory declaration as to their travel status, that is, whether they are vaccinated, recovered or in possession of a negative test or and the form of proof. This determines what other public health advice, quarantine or testing measures will be applicable to the passenger, depending on what country they're arriving from. Once operational, the enhanced EPLF receipt will identify those that have a cert of an EMA-approved vaccination or recovery or negative PCR test, or who otherwise are exempt from the requirement to have a negative PCR test. For those travelling on a vaccine or recovery cert, no further pre-departure checks are required by carriers. For passengers travelling on a test result, will be required to provide proof to the carrier of that test taken not more than 72 hours prior to arrival, or they will be denied boarding or embarking. The EPLF is not reliant on the digital COVID cert, but complements its use, and the EPLF applies to all EU and non-EU passengers with or without a DCC. Passengers arriving from designated states who have pre-booked a place in a mandatory hotel quarantine will be met at the aircraft and escorted separately from other passengers through the airport building for check-in as required. Children aged 11 and under do not need to take an RT-PCR test prior to travelling to Ireland. Children of any age travelling with accompanying vaccinated or recovered adults will not be required to self-quarantine post-arrival. However, where one accompanying adult needs to self-quarantine, then all children must also self-quarantine unless vaccinated or recovered themselves. A verifier app has been developed to support checks of the digital COVID cert, which includes a mobile device to scan the QR code, and Border Management Unit and Garda Síochána are conducting spot checks of public health documentation, including the digital COVID cert, at ports of entry to the state for the purpose of ensuring the integrity of the enhanced public health regime. And the verifier app has also been made available to carriers should they wish to avail of it. It is acknowledged that there is considerable complexity associated with travel at the moment, given the impact of COVID-19 worldwide, and part of the group has been to provide a unified source of information to the public. There's comprehensive information on both the digital COVID cert and international travel in general on gov.ie/travel and www.dfa/travel, and both web pages are being kept up to date with all of the latest information. And I cannot emphasise enough the importance of checking on these online resources if you can, in preference to contacting the call centre this week. So the call centre has been created at an exceptional pace to manage the required workflows and communications, and this has required incredible effort across multiple government agencies to put in place the people, processes and the technology required. As you'll know, an interim emergency line was put in place on the 13th of July in advance of the contact centre going live fully on the 19th, given the level of public interest as soon as the first certificates began to issue. We know that there have been long waiting times for many callers, and the centre has not been able to meet the level of demand, which involved over 40,000 calls in the last 2 days and over 34,000 calls yesterday alone. This far exceeds estimates of call centre demand based on assessment of travel bookings and survey or insights data on travel intentions that government or industry have access to. It's also important to say that unlike many industry call centres, these are complex queries with over 150 scripts being developed to assist agents to answer callers' queries. It is also the case that the rapid issuing of 2.1 million certs in just over 1 week has inevitably bunched inquiries to the centre in these initial few days. The centre ramped up to 55 agents between Monday and Tuesday, with a further 30 agents to be added during Wednesday. And as agents become more familiar with the complexity of queries, we are anticipating the number of calls handled will increase. We had technical capacity issues on Monday, and we increased that technical capacity from Tuesday through a second free phone number that will cater for a significantly higher number of calls. An increased number of agents are now available to answer calls. But I have to say that the call volumes are at unprecedented levels and the call centre remains exceptionally busy. We are adding further agents on a planned basis after training over the next 2 weeks. We're urging people to only call the call centre if they have an urgent call and they're travelling in the next 10 days. And it can only support queries in relation to vaccination certificates and recovery certificates. Again, we've emphasised this in communications, but the centre is getting calls from people with requests for certificates for PCR or antigen tests. These certs are generated by third-party providers, and details of how that system works is available on gov.ie/travel. Current demand suggests that many people are calling are not due to travel in the short term. So these non-urgent calls are adding very significant waiting times to all calls and preventing many urgent calls from getting through. So again, we would urge people to only contact the call centre if you really need to and you're travelling in the next 10 days. Between Monday and Tuesday, the initial call centre handled about 2,800 calls, and many of these calls have had to deal with multiple requests, so they're complex and take time. So for example, requests for a full family details. Already over 1,000 certificate details have been sent for regeneration, and it's expected these will be reissued within 5 days, and a further 700 queries have been sent to the HSE requiring further investigation before a cert can be issued. The call centre will continue to evolve over the coming days, with new services added to meet emerging concerns and demands from members of the public, and a new online form to request recovery certs for eligible persons will be released this week. We do regret the delays some people are experiencing, and we are learning and continuing to improve the service every day. In terms of anyone who did not receive their certificate yet, if you're not travelling in the short term, we suggest you wait a few more days, as we are working hard to clear the final batches of certificates not yet issued, which is due to incomplete data. Additionally, undelivered certificates both by email and post are being reviewed, which may address some of the queries that people have, and these are being proactively managed so we can reissue as quickly as possible. We absolutely appreciate that any member of the public who has not yet received a cert or has an error on their cert that may need to be corrected may be anxious. However, we are satisfied we will be in a position to resolve queries quickly, and unless you need your certificate urgently, we would encourage you to wait a few more days. The likelihood is that certs not yet issued will arrive, and as the call centre ramps up, we'll be in a position to deal with all the calls more quickly. In summary, significant work has been undertaken over recent weeks, including the technological developments that were required to be stood up at pace, complex data governance arrangements, and the scaling up of all operational matters through the end-to-end solution. However, the process will remain under ongoing consideration, with the review to further refining and enhancing over time. And in conclusion, I want to commend my colleagues across the system for the extraordinary effort and collaboration which has allowed for the data collection, certificate generation and issuing over 2 million certs from a standing start in just over 6 weeks. Again, I want to assure the public that we are making every effort to ensure they get their certificates in good time to travel, and no effort is being spared to resolve delayed certificates and any certificates errors as quickly as possible. Thank you.
Thanks very much, Liz. A lot of information in that, and as you say, from the phone calls, 40,000, 34,000 yesterday, there's huge public interest. So I suppose today's meeting is a lot, to try and maybe answer some of those questions that the public have. And clearly, as public representatives, we've been getting many of those phone calls and many of those people desperate for information. So hopefully today's meeting will bring some sort of clarity to some of the questions that people have at home. So again, to thank all our witnesses who have made themselves available here today. So our first question here is Colin Burke.
Thank you very much, Chair, and thank you to our guests here this morning. And can I just thank them and all of the people involved, both in the government departments and the HSC, for the work that has been done in trying to meet the timelines. And I know that there are many challenges, but there are also, I suppose, concerns by the general public. In particular, can I open on the whole issue of the call helpline? It just doesn't appear to be working. It doesn't seem to be able to deal with the volume. And I'm just wondering, was it looked at to know whether or not it could be done by way of email, that there would be email in? So rather than people waiting, we've had people onto my own office in Cork that were on the phone for 2.5 hours and still did not get anyone to answer it. So I'm just wondering, can we look at a better system than people having to wait for 2 hours on the phone? That's the first thing I just want to touch on. The second thing I want to touch on, and you referred to it in your statement, and it was on the, received coverage this morning about people who've arrived in Malta and are now required to go into quarantine. And it appears that they did have cards proving vaccination, but that's not acceptable. What can be done to deal with that issue from, using our diplomatic skills out there? And do we have someone on the ground out there to deal with those challenges? I mean, it must be extremely difficult for a family to arrive out there and find that the whole family are now in quarantine for the next 10 days or 14 days. And the third issue I just want to touch on was that we've received correspondence in relation to, breach of the whole issue in relation to, the fundamental rights in respect of infringement of rights in relation to what's contained in the app. And I'm just wondering, maybe you might go through that, or maybe one of your other assistants might go through that, because they have sent a very detailed letter, and they have, that's the Civil Liberties Group, have raised a lot of issues about that we're not complying with the people's personal rights in relation to the data that's stored on the app. So maybe if we could start with those three. Thanks.
Thanks, Deputy. So first of all, in relation to the helpline, as I said, we did obviously some analytics prior to the setup of the call centre. Now, we were doing it very rapidly, so we were always under pressure in terms of the build. But notwithstanding that, any of the data we had in terms of intention to travel, bookings made, certainly wouldn't have given us cause to think we would have the kind of numbers of calls that we have had. So there's no doubt this is way beyond what we would have anticipated. So, I mean, we were on a very tight schedule. So in terms of stand-up, what industry colleagues who've been guiding and helping us have been telling me is this is pretty unprecedented start-up in 6 weeks. So as I say, that's not an excuse, that's just the reality. And we did our best to anticipate what the level of demand would be, but the indications didn't give us any sense of that. Notwithstanding that, obviously, we would always like to further automate the process. And I mentioned there that we pushed out as many certs as possible for that reason, so that we would have, most people who wanted one would get one. We acknowledge that there have been some bounce backs, and we have to deal with those. And there's a small number that still are being issued over the next day or so. We are setting up the recovery portal, which will actually divert, hopefully, most of those calls online, where people can complete the form online and fill in the data in their own time, and we can generate a cert based on that. And we are looking to further automate the system as we work through and assess what are the kinds of queries people have, so that we can get quicker at, I suppose, processing some of those calls. We also think there's, people. There's a lot more information available than people may realise, so we are trying to direct people to the website as well. Derek, I don't know if you want to say anything more in terms of the stand-up on the call centre, but it is every day we're adding capability. But Derek, have you anything else you might want to add?
Good morning, Chair. Good morning, Deputies. Just I suppose just to add, when we've started up using a mixed model of existing call agents across our system, and we're also using support from a private partner. As Liz said, we've opened yesterday with 55 staff. We will increase that to 85 by tomorrow, and over 100 into next week. I think, in fairness to the Deputy, you've raised an important point around other channels. We did look at email, but actually our agents have functionality to fix queries at source. So we will try and resolve the query at source within the existing HSE data systems, rather than just create another backlog that needs to be resolved. And where we can't fix data, it's escalated to the HSE to resolve. As my colleague Liz says, tomorrow we hope to launch a recovery portal which allows people self-serve queries to have around recovery certs. And over the coming weeks, we will increase additional channels such as SMS, chat and callback. But that will be over the next 2 to 3 weeks, and hopefully that'll give other avenues or other channels for members of the public to engage with the call centre.
So then, Deputy, in relation to your second issue in relation to people who have travelled to Malta, so we don't have anyone on the call this morning from the Department of Foreign Affairs, but we have been assured that people are getting assistance on the ground. And every assistance that can be given. And I'm not going to comment, obviously, on individual cases, but just to say it does very much underline the need for people to check. This is a highly volatile situation worldwide, and the rules are available online in terms of what is required. And if you look at the rules for entering Malta, they are very clear as to the requirements in relation to the digital COVID certificate, and they don't accept handwritten certs. So again, these are the rules that are being updated on a regular basis by ourselves and all other countries. So that's that we would really urge people to check their destination before they finalise their plans.
Yeah. Sorry, can we get more information out to people on that? Because I think, while I know the department and the HSE have advised people to check, but I'm not sure whether the message is strong enough.
Sure.
And I think it's difficult now when people arrive in with a family and suddenly they're finding that they're not complying with the regulations.
Sure. So we have our landing page, gov.ie/travel, has a fairly easy, fairly intuitive drop down, and included on that is access to this Reopen EU website, and that's the one that allows you to put in where you're travelling from, where you're travelling to, and it's really got all of the up-to-date information. But we'll make sure we amplify that over the course of today as well. And then finally, in relation to the issue of the app, we have been very, very careful in relation to the development of all of the data flows around the issuing of certs and everything we have been doing in conjunction with conversations with the Data Protection Commissioner. But I'm going to hand over to Barry Lowry, my colleague in the OGCIO, who's most familiar with the app and its development. Thanks, Barry.
Thanks, Liz, and thank you for your question, Deputy. What I would say about the app is, first of all, this was developed in a privacy-first basis. So it was developed in a format that we call a decentralised solution. In other words, government do not know what people are doing with the app on their phone. It was never designed for government to collect information on people. And so the data collected on location and so on is very broad, so that an individual cannot be identified. And actually the app was developed to meet the best principles of privacy right the way through, and it was developed through consultation with the public. So as Liz said in her opening remarks, an individual can choose, there's three main parts to the app. They can choose to switch off one, two, or all of them if they want to. They can choose any part to use that they want to, and so it's very privacy oriented. What I might say in your first question as well, Deputy, is that we looked at various channels to support the public, but unfortunately most of the requests coming to the service desk are about getting certificates fixed, and obviously the same issue applies. It's an issue of privacy, and so therefore some questions to be asked? Sorry.
Can I just ask you, the letter we've got from the Irish Council for Civil Liberties says this new functionality would go far beyond the app's original scope and would, prima facie, not be in accord with European Data Protection Board guidelines in relation to working apps, or in relation to tracking apps, sorry. So, I mean, that's what they're saying to us. So, how would you, what's your response to that?
I can come in there, Deputy, and Liz, if that's okay. Maurice O'Connor here from the Department of Health. The COVID Tracker app was always more than an exposure notification app, and it always had multiple purposes, as Barry set out. It is technology deployed as a pandemic response tool, and it already carries the function of exposure notification, as you know. There's a check-in function, and it's an information platform. And what we're doing here is adding a digital wallet that allows people to carry the EU digital COVID cert digitally. Its architecture is decentralized, and it has been built on the basis of privacy by design. I too and the HC are in receipt of the correspondence from the Irish Council of Civil Liberties and Digital Rights Ireland, and we will be responding to them and actually have engaged with them over the last while. An important thing is that as a pandemic response tool, all this infrastructure will be dismantled at the end of the pandemic.
Okay. The reason I'm raising it is that I don't want to.
Colin, we need to come to an end.
Yeah, where something that we're using will suddenly have to be stopped. So I'm just make sure that we have clarification on that, because they're saying it's not in accordance with European Data Protection Board regulations, guidelines. So they're setting this out in writing, and that's why I'm raising this issue.
Deputy, it's a misunderstanding. You see, if the app was set out with a scope and purpose confined to exposure notification at the start, then the advice from the European body would be relevant. But we set the app up very deliberately and in public through the data protection information notices, through the data protection impact assessment, as a pandemic response tool with a number of functions. And we've worked very closely with Barry, with cross-government, with our data protection office, so that that's understood. The functions are entirely separate. You can turn off exposure notification. You don't have to check in. You don't have to read the update information. You can carry any or all of those functions. And because of the vaccine rollout and the fact that the central database was established in April, and we were delivering, HSE were deploying vaccines as best as possible before that, we had to issue, as you know, almost 1 million paper certs. And the digital wallet facility on the app is a very, very convenient thing, completely at the discretion of every individual, completely private as regards what every individual does. But it is a facility to have a digital version of your app. And that was part of our obligations as we understood them under the EU law. Deputy, thanks.
Thank you. I need to move on. David Cullinan is next.
Can you hear me? Go ahead, Rod.
Yes, go ahead.
Thank you very much. Ms. Canavan, I just have a number of just very simple questions first. I'm just trying to get a sense of what line department has overall responsibility for the DCC.
So as I've outlined, it's a distributed in terms of the work that's involved in order to get it done.
Has any department overall responsibility?
So in terms of, say, data control and the management of the call centre and the policies from that point of view, it's the Department of Health. As I say, the OGCIO has, under a data processing agreement, general the search.
My time is very limited, so the Department of Health has elements of it, and other departments have other elements, but there's no department that has overall responsibility for it.
Well, it's a cross-government project.
Cross-government project, yeah, I understand that. What I'm saying is there's no department has overall responsibility.
Well, I guess in terms of the digital COVID cert and its requirement, it's generally in most countries considered to be within the scope of the Department of Health. And
okay, and leave the department then.
For most of the elements, yes, and certainly in terms of data control, which is very important, they are the data controller along with the HSE.
Okay, who's responsible then? What department is responsible for the travel element of it?
In terms of the policy?
Yes.
Well, as you know, government is responsible for deciding on the travel policy.
Yeah, but what department? So, for example, if there's queries in relation to its use, for example, there are people that are stuck in Malta, and then its use in terms of whether or not you need a DCC sort of travel in the first place, other forms of vaccine proof, maybe, okay, who's responsible for that area?
So these are policies of other European countries. So in terms of ensuring that citizens get the information they need, again, we're using the gov.ie platform, and that's supported by the Department of Health, ourselves here, and the Department of Foreign Affairs in ensuring that we have the latest information, particularly in relation to other jurisdictions available on that platform.
Okay, I want to come to your opening statement and some of what you said in relation to the call centre. So you say, and I quote, "We know there have been very long waiting times for many callers, and the centre has not been able to meet the level of demand, which involved over 40,000 calls in the last 2 days and over 34,000 calls yesterday alone. This far exceeds estimates of call centre demand based on an assessment of travel bookings and survey or insights data on travel intentions that government or industry have access to. I'm sure you're aware as well that the DCC sort is also being used for domestic purposes. So when people are calling the call centre, it's not just in relation to travel queries. People will have had queries as well in relation to its use for domestic purposes. Why was that not built into your assumptions in relation to how many calls that would have been anticipated? You're on mute.
So, as you know, Deputy, the issue of the use of DCCs in other settings, including hospitality settings, was only decided by government last week. So we have been, the task we were set out with was in the context of our European obligations, the free movement obligations, and the travel between states. So that was our primary focus, and that was what we built on.
Sorry, Ms. Canavan, sorry, I have to stop you there. We've had government ministers say that the DCC is also being used for domestic purposes. We've had a lot of people looking for queries in relation to when they will receive their DCC, but also proof of recovery. And we know that that was one of the reasons why the helpline was being set up, or at least one of the uses of the helpline. And what you're saying is that, yes, a number of weeks ago, when you first looked at this, it was for travel purposes. But for the last number of weeks, for a long number of weeks, we have known, because there has been discussions with the industry, that it was going to be used for domestic purposes as well. And what you're saying in your opening statement is that we based our assumptions on how many calls we would receive on travel alone, and not based on people making queries in relation to its domestic use. So was it no wonder that your system was overwhelmed?
So thanks, Deputy. So yes, in the last fortnight, government made a decision in relation to the use of certification in the context of hospitality. Absolutely, I totally acknowledge that. Regardless of what our information was at that point, we could not have built the call centre faster than we did within 6 weeks. We have stood it up in an incredibly short space of time, and we are continuing to add to it. But regardless of the additional information we had in the last 2 weeks and the expected demand, of course, we could have anticipated that in the last fortnight, but it wasn't going to allow us to build the capability and capacity any faster than we had already planned to. And we have continued to accelerate that, and we put in an emergency line last week to try to spread out some calls. And also we have developed the portal for recovery for later this week, again, in response to what we now know was a much larger likely demand than we had anticipated when we started out.
But it would not have taken a rocket science to figure out that there would be very high demand. And I'm not putting all of this on you. What I'm saying is that the communication of this has been absolutely appalling. So people anticipated that they could make a call, get a response, and it hasn't happened. So I want just to drill down into the information if I can. You said that there was 40,000 calls made on Monday and Tuesday. Is that right? You're on mute again.
Over 40,000.
Over 40,000. So that was calls made. So are you saying then that only 2,826 calls were actually handled on Monday and Tuesday?
So that number of calls were processed, as in they spoke to an agent and had their query specifically dealt with. There will also be people who got information as part of the IVRL system, which allowed them to either be redirected, get the information they were looking for, or be directed to either the Department of Foreign Affairs lines.
Have a breakdown of those figures, Ms.
Not at this stage.
And that's part of the problem. So I think we can take it for granted that 2,826 people had their calls processed and had the information processed. Okay? I would imagine that there are thousands that did not. I mean, I think it's a fair assumption to make that there's a lot of people that simply did not over the course of Monday and Tuesday. Would that be fair?
We absolutely acknowledge that, Deputy, and we are working very hard to ensure that people get the information in the easiest possible way. We would also say that there are people calling at the moment in relation to matters that the call centre cannot deal with. For example, looking for test certs, which the call centre does not handle. And we also have people calling in relation to recovery certs, even though they're not eligible for them. So we have a whole raft, and we're analysing all of that to reconfigure the call centre, manage our scripts, and look to see what else we can automate in terms of managing that better.
How many staff members are there at this point in time today in those call centres? And are they all based in Ireland, or are there some based outside of Ireland?
I'm going to hand over to my colleague, Derek Tierney. Derek, do you want to take that, please?
I just need more numbers because I have a very short time. So, sorry, it's just the numbers I need.
Yeah, as I said earlier, Deputy, we've currently 55 agents on our books today. We'll increase that to about 100 this day next week. So we're going from 55 today, 85 tomorrow, and over 100 next week. The majority are all Irish-based across existing agencies, across government and contracted staff. And I'd just like to go back on our initial call agent volumes were based on booking data, travel booking data. It's a fair point you make. There is a wider societal debate around the use of DCC, and we've already booked up call agents in excess of those initial demands. So as I said, we have added staff.
I just needed the figures, and thanks for that. Because
55, 85 and over 100.
Perfect. And just the last question I have is in relation to a tweet that was put out by Minister Oisin Smith on Monday, where he said that the DCC is not essential for travelling. You can still travel on your vaccine card or a negative PCR test. And yet, as we know, people in Malta found out, in fact, that's not the case, that they now have to quarantine. So can I ask what the advice now is from the department? Should people be travelling without a DCC? And are there other countries where it might be problematic for people to travel that they may get into difficulty? Because I just finished on this. This is all part of the confusion. Like to say that we could not have anticipated the volume of calls, it's just to stretch people's patience, I have to say. To then not build into the assumptions in terms of how many calls that this was also being used for domestic purposes, which would drive up the demand and the pressures on the system, is also going to stretch people's patience. Then you have contradictory statements coming from ministers, and a minister saying, yes, you can travel without your cert and your vaccine card would be enough, and then we have people ending up in quarantine. So can somebody clarify what the actual advice is now from the department for people travelling, please?
So first of all, to say, Deputy, of course, as of the last couple of weeks, we were anticipating a greater number of calls, and we acknowledge that, and we bumped up our numbers and put in additional resource to try to respond to that. So just to be clear, we did, of course, anticipate that, and we did our best to meet that need. In terms of the people travelling, what we're saying to people is it is very important that people don't conflate your right to travel or your right to board with your DCC. The DCC is an accreditation that is verifiable and accepted across the EU, which tells the country that you're arriving in what your status is. And they have their own quarantine rules, and they have their own domestic policies in terms of what they accept as verifiable proof. So what we're saying to people is The most important thing you have to do is check, number one, what the country requires in terms of a passenger locator form. Most countries do require that in advance. Many countries require that as part of that you indicate your vaccination status or your test or other status. And all countries who are participating in the DCC.
One very quick point, and I accept all that, Ms. Canavan, but my point, Ms. Canavan, is if you have a government minister that is saying that a DCC is not essential for travel, then I'm simply asking, is that good advice?
So what we have to be very, very clear on is that the European initiative is to facilitate travel and not prevent travel. And no country is allowed to prevent anyone from travelling based on whether they have a DCC or not. But what countries can do is they have their domestic rules in relation to what public health restrictions they have in relation to people and what they accept as verifiable proof. And that's the difference between the two. And that's what people have to be very conscious of. The Reopen EU webpage is really helpful in this regard, where you can put in where you're coming from, where you're going to, and it will set out all the rules in detail as to what's accepted, what's not, and what the various quarantine, test or other rules that are required to the destination you're travelling from. It's a highly volatile situation, and it's very difficult for us to give definitive advice on any particular country on any given day. And we ask people to make sure they check before they finalise their plans or they travel to make sure they have everything that they need.
Thanks very much, David. We need to move on. Lorraine Clifford-Lee is next.
Thank you very much, Cathaoirleach, and thank you to the guests for coming here. Like my colleagues have already raised, I have a number of issues with the certificate and the helpline, but I'm going to focus my questions today in relation to the Irish language and how it relates to the certificate. And you know, I'm sure you're aware that the spelling of the names which contain Ashina Fada have been completely incorrect. Scrambled versions of people's names are printed on the certificate. And this has caused a great level of upset and distress for people across the country, but particularly in Irish speaking communities. And I was wondering when will a correct version of people's certificates issue to them?
Thanks, Deputy. I'm going to hand over to my colleague Barry Lowry to explain, I guess, what happened and where we're at in terms of the remedying of that issue. Thanks, Barry.
Thanks, Liz, and thanks for your question, Deputy. First of all, I would like to explain what actually happened. So how the process works is that we receive...
Barry, if I could just interrupt you there. I have a number of questions, but if you could just directly answer, because we have limited time here today. So I just want to know, when will those people get their correct certificates? Okay, so the issue's been fixed. But obviously we don't know who has received an incorrect certificate. So there's a process of resolution where they will need to phone the call centre, and the call centre can reissue their certificate with the proper spelling on it. That's completely unacceptable, Barry, because the mistake wasn't made by those people, and they shouldn't have to go out of their way to go back and correct your mistake. So I was wondering if you could put a remedy in place. It should be easily identifiable who actually got the incorrect certificate. Well, Deputy, that's why I've tried to explain what happened at the beginning, because it's important to the resolution. In some cases, there were issues with the data input from some of the GP systems, and in other cases, it was how the file was set up for processing for print. The second case is resolved. In the first case, we just simply don't know where there's data incorrectly entered or where it isn't. And that's why if people fall into that category, if they let us know, we can investigate and we can reissue the certificate. But the first category there that you said has been resolved in relation to the printing, can those people be identified by yourselves? What we're trying to do is identify which might have fallen into that category. The difficulty here is that the vast majority of certificates that were posted, as opposed to emails, came from people who were vaccinated in GP surgeries. So we're not
always clear in what instance where it's data entry and in another instance where the actual data is correct, but it was the preparation for printing that made the error. So we are trying to investigate, but it is a slow process.
And given the number of difficulties you're having with the call centre, will there be a dedicated line set up for people to correct this mistake?
So we're setting up, we've got a resolution process. As Liz explained at the start, if we could be in a position where priority calls, first of all, with regard to travel, are coming through the call centre, then we can get those addressed as a matter of priority. The difficulty here is that we don't know, this is health data we're dealing with, so we don't know the priority of individuals when we're sending them out their certificates. Some people obviously have no intention to travel. Some people have urgent travel coming up, but there's no way to discern that from the data that we have.
Given the upset that has been caused by this and the complete lack of respect for the first language of this country, I would suggest that a dedicated line be set up. Given the mistake isn't on behalf of the people calling, it's within the system through both areas that you've identified there, could I suggest that thought be given to a dedicated line for people to contact? If I could move on to my second question there. The digital certificate isn't completely bilingual as is required, and there's a big section of information, around 8 lines in total, that have no corresponding Irish translation. And also, as it happens, the name of the country is incorrect on the cert. It says Republic of Ireland, and we all know that the name of our country is Éire, or Ireland. Why and how did this happen? And will these lines be completely translated going forward for any digital certs yet to issue?
Thanks, Deputy. I'm going to hand over to Maurice, if that's okay, Maurice.
Yeah, thank you, Deputy. I just want to acknowledge the error in the incorrect use of the name of the country. It is being corrected going forward. And with the COVID digital app, when the paper certs are sort of scanned into people's digital wallets on the phone, if they choose to do that, that would automatically correct the error on the name of the country. And I take personal responsibility for that. It was the Department of Health that were the issuing authority, and it was just with the pace of work underway, that was an oversight that I'm sorry for. The form, the structure of the form otherwise is, I would say, fixed. We have a balance of Irish and English in the form, and it would be unwise of us to adjust the form. The form is the one recognised all over the European Union now.
I'm sorry, I was just referring to, it's supposed to be completely bilingual, and there's a large section with 8 lines that is just in English. So when will the Irish translation of these lines in that particular section be made available? It's a legal requirement.
I'll have to come back on that, Deputy. There'd be a lot of considerations to take account of in adjusting the form. It is shared across the European Union. It's interoperable, and it has a lot of features.
The requirement to have the form completely bilingual was flagged well back, as far back as April, and it's completely inconceivable that this wasn't an issue when you were planning this. And I know that it's probably difficult to do it now, but do you not see the big error there by not making the form bilingual?
There's a balance of Irish and English in the forms. I haven't put in front of me now.
There's not a balance. I'm sorry, it's supposed to be completely translated. There's some bits of Irish in it, but it's not completely in Irish. And while I'm on that topic, the translation isn't even correct. And there's a number of big errors within the translation as well, and it doesn't make sense. For example, the line there, disease or agent targeted, is completely incorrectly translated. And it actually, the Irish meaning of that is that the person that holds the certificate has COVID-19. So are you telling me that first of all, the whole form isn't going to be available bilingually, and the very big errors in the translation of the certificate won't be rectified.
Deputy, could I suggest we come back to you on those points?
Well, it's a simple yes or no answer.
I would say all of the essential pieces of information on the form specified by the regulation in Europe are in both languages. We'll look into it. I haven't the form in front of me right now. We'll look into it and we'll see what we can do. Thank you.
Well, I'm not satisfied with those answers, to be honest. You've said that you're not going to change it, basically, and it's supposed to be completely bilingual. And to actually have very bad translation, I want to know how the form was translated as badly as it was.
Deputy,
was it translated in-house, or was there an outside translation company used?
I haven't that information right now. I think it was an outside contracted to the civil service.
Okay, well, if you could get back to me on those specific questions. I have a further question here. The call centre, will there be any agents available to take queries through the Irish language? Because there are currently no Irish-speaking agents available.
Derek, I'm not sure if you have any information on that to hand.
Not to hand, but I'll revert through the chair to the deputy.
Okay, and a further question. The situation where people's name on their digital certificate doesn't exactly match their name on their passport, for example. My digital cert, when I do eventually get my second shot, will have Lorraine Clifford Lee, as that's the name I registered with, but my passport is in my name prior to marrying and it's just Lorraine Clifford. Will I be able to use that?
So again, what we're saying to people is we know what we can look at in the context of people arriving back to Ireland, but we don't want to give any false assurances to people travelling elsewhere. But there will be facility to amend that to match your passport, and that can be dealt with and it can be reissued on that basis.
And, you know, there's a tradition in Ireland sometimes of people being known by their middle name, but actually their first name is a different name. So you're saying that will be, or people using their Irish version of their name might be John, but they go by Sean and they've registered for their vaccine under Sean. So there will be a facility to rectify that.
Yeah, we're assuming that what most people are going to want to do is have it match their passport for travel purposes. And if we can authenticate that people are using a name that is their known name, we will be able to facilitate that.
Okay. Well, I would appreciate if you could get back to me on the specific questions that I asked, and I'll leave it at that, Chair.
Thanks very much, Lorraine. Roisin Chartall is next.
Thank you, and thank you to all our guests for your attendance. And my first question relates to the COVID tracker app and the decision to allow the DCC information to be uploaded on that. Can you explain just how the Department of Health and the HSE made these changes to the app without a proper data protection impact assessment having been carried out?
So I'm going to hand over to Maurice and to Barry in relation to the app. Thanks, Maurice.
Thank you, Deputy Shortall. I can assure you that we didn't make the changes without an assessment of the data protection implications. The app advisory group, which I chair, met and considered the matter, and after deliberation approved the addition of the additional function. The data protection impact assessment has been updated accordingly, and it's publicly available on our websites. And the data protection impact notice, a shorter, more accessible document, has also been updated. So we have fulfilled all of our obligations under data protection in respect of the app.
The DPC satisfied with that?
The DPC don't ever confirm satisfaction, but we have engaged with them and they're fully aware of what we did. They're fully aware that we were intending to do it. So you don't get approval from the DPC. They reserve the right to maintain their role as regards the operation of the app and to hold us to account for the data protection responsibilities that we have. And we treat those very seriously. And the app is absolutely privacy preserving.
Okay, so are you saying that no issues were raised by the DPC?
In the context of the delivery of the Ireland's obligations under EU COVID cert, there was no issues raised with us.
Well, sorry, I mean specifically the decision to upload the DCC information on the Tracker app. You're saying that no issues were raised by the DCC on that action?
Yes, correct.
Yes.
Okay.
And Deputy, maybe just for clarification, it's a wallet facility, it's a convenience facility.
Yeah.
You don't have to give that information to anybody you don't want to give it to, and nobody else can see it except you. So just to be really clear. Yeah.
Thank you. I want to go back to that issue of Minister Smith and the tweet saying that the DCC is not essential for travelling. Now, I mean, there's a lot of confusion around this generally. And I mean, I fully appreciate that as officials, you've been asked to do a lot of things in a very short space of time, and some of them questionable. So I want to ask you just, what now is the advice that you would give to people travelling in relation to the need for having a DCC? Can you say that in one sentence?
If you're eligible for a DCC, our advice would be to use your DCC when you're travelling, absolutely.
Yes, but would you say to people it's not essential to have that?
Again, it's actually part of the EU regulation that it cannot be a barrier to travel. It cannot be a requirement to travel. So just to be really clear. And that's that we don't want to conflate those two things. It is actually a requirement under the regulation that it cannot be used to prevent travel. It's there to facilitate travel. So what it is it's a proof that all countries understand the validity of, how robust it is, and it's verifiable. So that's what it is. And some countries are saying that's the standard they require. So we can't determine what other countries will say, but the information on what their standard, the standard they require, is available on that European website, Reopen EU. So that's what we would say to people, that is it's the highest standard of proof for within the EU.
So can I just pose the question in a different way? Can a vaccine certificate or negative test result be used in place of DCC?
So, Debbie, it will depend on the country you're travelling to. That's what I'm saying to you. And if you go into that website, it will tell you. And some countries will accept it, but not all. Yeah.
Okay, so that needs to be advice.
Yeah, absolutely.
Rather than saying a DCC is not essential. Okay, which has caused a lot of confusion and inconvenience for people.
And we have this information up on our landing page, and we are continuing to sort of bring forward the issues that are rising and amplify those, and we'll continue to do that in the coming days. But I absolutely agree, yeah.
Okay, thank you. And are there plans for a public information campaign in that respect, given the experience of people, very bad experience of people over recent days?
So we have run a print ad campaign and a radio campaign in the last probably week to 10 days. I suppose what I can say is there is so much complexity that it's not possible to give a whole lot of information in those types of campaigns. So what we really are is directing people to the gov.ie/travel. There is really detailed information there. We've tried to make it as intuitive as possible. We've tried to answer as many questions as we can, and we're updating that on a daily basis in real time in terms of any issues that are coming up. So it's a really good resource for people, and anyone who can access the online information should do so. It's very up to date, and that's our primary focus. It's very difficult to make general statements in a print or radio ad, but we are trying to direct people to that source.
General statement should be very wary. It should be people should be very wary of the different rules that apply in different countries.
Absolutely.
Saying you don't need your DCC,
yeah.
and that's the point I'm making.
Sure.
So in relation to check documents, and you've said that there'll be verification of the digital COVID certificate, and that the Border Management Unit and An Garda Síochána will be conducting spot checks. And I suppose there's a lot of concern about these proposals in relation to travel, but also in relation to indoor hospitality, and whether the systems will actually work, and will there be real enforcement. And I think a lot of people doubt whether there will be or not. So in relation to the Border Management Unit and the Gardaí, have they been provided with additional resources to carry out these spot checks?
Thanks, Deputy. I'm actually going to hand over to my colleague, David Gilbride from the Department of Justice. Thanks, Dave.
Good morning, colleagues, Oireachtas colleagues. Thanks for the question, Deputy. I suppose I should say in the first instance that the EU guidance is very clear that the check should be undertaken in the country of departure in the first instance.
Yes. Sorry, if you don't mind, David, just can you answer that question? Have those two agencies been provided with additional resources?
That's your last question, Roisin.
You're on mute, David.
My apologies. In relation to the Border Management Unit, two types of additional resources have been provided. First of all, we provided additional technology to them in the terms of the Verifier app and the hardware required to allow them to do that. And we're also providing additional staffing at the airport to ensure that we have adequate staffing to make sure all of our immigration ports are open at all times and that the additional work associated with checking is properly resourced. In relation to Garda Síochána, the Deputy, I think you're on mute now.
Thanks. In relation, just because of the fact that the checks on travel have been so incredibly lax over the past year or so, can you send us on the details of the additional resources, including staff resources that will be available to both those agencies?
Certainly in relation to the BMU, I'll contact colleagues in Garda Síochána in relation to the other matter.
Thank you.
Thank you. Gino Kenny's next.
Thanks, Gerlach, and thanks to all our witnesses today. And I know this is a very complex issue, and we're living in kind of unprecedented times. Just in relation to this opening statement for certificates for persons not vaccinated in Ireland. So, for example, just this kind of example, if somebody from Britain is coming to Ireland as of now, how can they access, say, indoor hospitality as of next Monday if they've been vaccinated in Britain? But how actually could that person get a DCC in order to access indoor hospitality? So that's just the first question.
So first of all, just to say, Deputy, in terms of the hospitality and the regulations and rules that will apply to that, they are currently in development and they're not the work of this particular group. So just in terms of the standard that will be required there. But I guess it is fair to say that as it stands, we have been recognising the NHS certification. So you don't need an Irish cert in order for it to be recognised. It simply needs to meet a certain standard, and that will be set out in regulations. And for the purposes of travel, that standard is set out in regulations.
Okay. And just in relation to third country passengers, and obviously in the statement said that's ongoing. So, for example, an Irish passport holder that's, say, living in the United States, Canada, certain parts of the Middle East or anywhere, if they come to Ireland, what, like, time-wise, what are you be looking at in relation to equivalency? That was a decision that was given to Switzerland on the 9th of July. What would, in time-wise, obviously that some of this could be out of your remit, but in relation to our citizens living elsewhere in third kind of country kind of situations, what are we looking at time-wise?
So just to say, I mean, it is helpful if the EU take a view on interoperability, but of course it is open to us in terms of the standard we set as to what we determine we would consider to be robust and verifiable proof. So it will be possible for people to meet a standard without the EU absolutely declaring that they are entirely interoperable. So our travel regulations allow that we can accept certs once we're satisfied they're verifiable and robust. And of a standard equivalent to what we're getting in the context of the European DCC system. So we have the capacity to do that without waiting on the EU, but obviously if there's interoperability, it makes it even more, gives us even more confidence, yeah.
And if they're not EMA approved, because there's a cohort of Irish citizens living in UAE at the moment that have got vaccinated, but not EMA approved. In the situations, in a situation like that, what happens to people that have been vaccinated by I think it's a vaccine called Sinopharm. In a situation like that, what happens to citizens that come back to the country if they're in a situation like that?
So I'm going to hand over to Maurice in relation to the standard in relation to EMA. So go ahead, Maurice.
Just in short, Deputy, the EU DCC applies only to the suite of vaccines approved by the European Medicines Agency. So vaccines not on that list wouldn't count towards vaccination in the EU DCC at the moment. On the issue of third country equivalence, as you know, Switzerland has an EU level equivalence. There are 40 other countries in conversation with the EU at the moment who have submitted applications for equivalence decisions. So I expect that there'll be quite a bit of development on that. And as Liz says, it's best that it's done at EU level, but we do have discretion ourselves to recognise appropriate certs. Thanks.
Is Britain one of them 40 countries?
Yes. Yeah, Britain, US, Canada, loads others.
Okay, just a very, very final question, just in relation to, I know Senator Clifford Lee said this, in regards to those that have been vaccinated in relation to their name on their vaccination cert, that's different to their passport. So somebody will then have to ring the hotline. What's the process of, and what time frame are we looking at if, to get that changed from the time of the call to the time the cert is reevaluated and sent out to via email or post? What time are we thinking? Because obviously there is huge demand in relation to phone calls and all that, and we understand that, but time frame, what are we talking about?
So what our view is, if a call is processed and it's not complex, we would hope, even if it has to go right back through the system, we would be able to reissue within 5 days. But if it's, it may be a little bit faster if it's more straightforward, but we're aiming for 5 days. Barry, is that fair?
Yes, Liz, thanks for your question, Deputy. The target we're working to is 5 working days, but as Liz said, there may be instances, a lot of them, where we can issue them faster. Preferably if, when the person's inquiring, they can give us an email address, because obviously that cuts out the need for post.
Right. So it could be as easy as changing from John to Sean for something like that. Would it be just say a very, very simple change with it?
Just to say, Deputy, I think obviously there are more simple changes. Say your email address is changed, but if there's a fundamental change, then further investigation has to be carried out to make sure that someone else's health record isn't compromised. That's why Liz said some of them can be a little bit more complex, but in the vast majority of changes, if it's just an email change or a change of address has happened, then they should be pretty straightforward to fix and get the replacement certificate out quickly.
And maybe just to add to that, Deputy, obviously we have to be satisfied that we can verify that the change is a valid one and that the person that's calling is the person. So we would have to make assure ourselves in respect of some of those matters where there's an identity change, shall we say?
Yeah.
Just to be careful.
And how worried would you be about kind of fraud? How worried would you be about situations where people's identity could be compromised in relation to something like this? Because obviously it could be done, like everything, nothing is bulletproof, but how worried are you in relation to fraudulent certs, being people being compromised in their identity?
We're always extremely worried about attempts at fraud in all matters of digital transactions with government, Deputy, which is why one of the things that we have under development is a self-help portal. But one of the things we need to do is make sure that that is not an easy target for either fraud or actually third-party attack, because as you know, health systems are often seen to be easy targets for third-party attack. So part of the time required to build this has been building adequate security around the whole process, whether that's an individual making a contact by phone or an individual making a contact online.
Thanks very much.
Thank you.
Martin Conway is next.
Yep. Yeah, thank you very much, Chairman, and thanks to our guests. You might just confirm how many certificates have been actually physically issued as of close of business yesterday?
We were at 2.1 million. Barry, I don't know if we've any update on that.
No, Liz, I'm using the same figures as close of play last night.
Yeah.
So it was, at that stage, there was 2.1 million total certificates. 1.1 million had been emailed, 950,000 had been posted, and 77,000 were due to be processed overnight. And we expect that they'll go out okay today.
So roughly 2.2 million. So by close of business today. And what is the shortfall? How many have to be done at this stage that haven't been done? How many have had complications? How many emails have bounced back?
Okay, so maybe Barry, you might say something about the bounce back on email or post, and then Damien, you might add a little bit in terms of what we think are the remaining outstanding. Thanks. Okay, thanks, Liz, and thanks for the question, Deputy. Of the 1.1 million emailed, we've had 7,500 bounce backs. In other words, the email address is no longer in use. So we know we've had a delivery failure on them. We can only assess the first 500,000 post at this point, but we had 7,920 letters posted, which were not successfully delivered. So I guess if we double that up, we're probably talking about 15 to 16,000 out of 935,000 didn't deliver properly.
Yeah, and are An Post aware of obviously the envelope that this is going in? Do they realise the importance of it? Have you protocols in place with An Post in terms of the ones that haven't been delivered? And for the certificates that bounce back by email, are you now proceeding to post them out? What is the procedure? Because this is, I suppose, a critical piece of state documentation that gives people liberties and freedoms and access to indoor dining, etc., etc. So I'm just interested to know, what are your procedures to deal with the bounce backs and the returned certificates by An Post?
So I'll maybe say initially, and Damien might want to add to this. What we do is we investigate every one, because in a large number, for example, of the posted certificates, we've been told that the person has simply gone away. So that might mean that they've left the country altogether, or it might mean that they're living in a different address. So if we don't have their new address and we don't have an email for them, that's a case where we really do need them to contact the service desk and provide information that we can send their certificate to them.
What happens then if a certificate is delivered by email, but it happens to maybe be a work email and it goes into junk? Obviously, you have no way of knowing if it went into junk. The individual, the recipient, may not realise it goes into junk either. Have you any way of dealing with that?
Well, Senator, one of the advices that we have online and the call centre would say is, have you checked your junk email? I think it's actually in the communications that we put up front as well, because we appreciate that can happen. I should say we went through a very robust process to make sure that the emails that were sent wouldn't end up being treated as spam by email servers. There's a process you can go through of assurance to minimise the chances of that happening, and we followed that process. That's why we didn't issue all the emails in one block. We did it over a period of several hours.
Okay. And look, I think most fair-minded people would realise that the task that you were given by government was enormous, and given the fact that not far off 70% of our population now have been vaccinated, we're probably ahead of a lot of other European countries. I'd be just interested to know what communication you have with other European countries. Is there a kind of a central kind of office that coordinates the digital COVID certificate among countries? Because obviously this is an international document. I'm just interested to know, like, are you fine-tuning problems in cooperation with other countries?
So, Deputy, there was a health grouping of the EU set up specifically to look at the whole issue of the digital COVID certificate. Ireland was represented on that grouping. And so we've been involved all the way through in getting early prototypes of the design of the certificate and making sure that our certificate met the EU standard, as Maurice said earlier on. But the other big area of involvement is what's called the interoperability gateway. So what actually happens is that we download every 6 hours the latest what's called public keys from the other states. That enables us to read the QR code of another state. So we download that every 6 hours, and every time someone at BMU or An Garda switch on the app, they download the latest version of the public keys, which means that if they cannot read a certificate from another country, it's an issue with the certificate. It's not an issue with the Irish verification process.
Okay, that's me done. Thank you, Chairman. Thanks to our guests.
Thank you very much. Bernard Dorkin is next.
Chairman, and again, I thank our guests for coming before the committee this morning. And I, like everybody else, recognise the enormity of the job that you have in hand. I think we should acknowledge and compliment you for taking on that job, having to take it on in the first place and taking it on. And notwithstanding that there were a number of ditches, that was to be expected. So I think compliments in the first instance. We acknowledge the magnitude of your task, and it isn't that we want to deliberately poke holes in what's happening. It means that it is better for everybody if we can have a seamless, smooth operation of any provisions. First of all, I want to mention the EU passport. The presumption is that it was going to be universally recognised, and of course that's not true, because different countries have the option of introducing rules of their own. As we know, Malta, an EU country, has decided on a different set of standards, and nobody goes on holidays to be quarantined in their hotel. So I think it is a huge blow to people who have gone on holidays and may have found themselves in that kind of situation. And can I therefore pose the question as to whether or not it might be possible to identify countries with different interpretations of the rules and to alert the travelling public to that in advance by way of an announcement or by way of something on the electronic media or whatever? That's the first question. It could eliminate a lot of double checking and crossing over.
So Deputy, just to be really clear, Malta is part of the EU digital COVID search system and does recognise the DCC. In the cases in question, as we understand it, some of the travellers did not have a digital COVID search, and they were relying on a paper vaccination card or other proof. And Malta's information on the EU Reopen website is very clear that they don't accept handwritten vaccination proofs, and that they require the digital COVID cert. So just to be clear, they have done that.
Right. How then can we prevent repetition? Is it possible to identify countries well in advance so that the traveller from Ireland, the tourist from Ireland, intending to some or other country, that they can see at a glance, look, there are problems here, this is not the same as all other countries, so can we do that?
So unfortunately, given the range of countries and the volatility of the situation, we cannot give that absolutely all day, every day. It really does depend on what the countries are doing. But what we have done on our landing page on gov.ie/travel and the link through to the Department of Foreign Affairs website, it does have the top 10 destinations with as much information as possible there, as up to date as we have it in relation to the requirements for those countries. So we have attempted to filter out into the most popular places, But again, what we're saying is the most up-to-date information on any given day in relation to the destination you're travelling to is on the EU Reopen website. And it's really easy to use. You put in the country you're travelling to, where you're coming from, and it explains the rules at both ends. So the best advice we can give to people is to check that before you travel. And as you're making your plans, and as I say, right before you depart, because rules are changing, and it's to do with, as I say, it's not to conflate the digital COVID cert requirements, which is one thing, the level of proof. Separately, people also have to check is whether quarantine, testing or other requirements may be changing in different countries. All we can really do is to make sure people understand that information is available, it is being updated in real time, and just to really remind people that is your safest bet to check those resources online before you travel.
Is it possible to update and streamline the helpline? Because when we get to the situation where the helpline becomes a need insofar as the traveller is concerned, can we separate out the ones that need to be dealt with instantly, or refer them to a position where they can be dealt with? For instance, we hear stories of people waiting for half an hour, 3/4 of an hour, 3 or 4 hours, and so on and so forth. That shouldn't be. It doesn't work. That cannot work. Because as we all know, in different situations, we can have calls backed up, and it's impossible when you have a number of calls backed up to track them with any kind of veracity. So can that be done? Can we do something there?
So what we do in the context of the call centre, and Derek may be able to add a little bit more, but what we've agreed with the provider is that we will review on an ongoing basis, day by day, and even during the day, as to what the level of demand is and how best to configure our teams in terms of the different types of queries that are arising, so that we can filter and put the right number of operators on to the different types of calls. But obviously we've only had a couple of days, so we're analysing that as we go, but it will change. I do think, there's no doubt that people are understandably a bit anxious, particularly if they get a state document with something not correct on it, or if they're travelling or they're worried about maybe using it in another context in the next few weeks, people are calling up. What we would say to people is, if you haven't received your cert yet, we really would urge you not to panic, because there are still certs been issued. And what we really would ask people to do is check the website, and over the coming days, unless you have an absolute urgent need, leave those lines free for the people who are travelling urgently and who do need to get their cert regenerated or indeed to receive it. And we will do our utmost to turn those around as quickly as possible. What we would like to get to is a more steady state, but we do understand people are anxious, and we are urging them not to panic. We do have a very good system for a turnaround, so unless you have an immediate need in the next 5 to 10 days, we would say don't panic. Things will settle down. We will continue to look at what's coming through on the call centre, reconfigure on that basis, and we will have the online portal, which will again draw people who are looking for recovery certs away from the call centre, and that's our intention. Derek, I don't know if you want to add anything else to that.
No, Liz, I think you've covered it. First piece of advice to everybody wishing to travel is go on to Reopen Europe, understand what the rules are for your destination country, so you're educating yourself. Liz is right, we are looking at the shape of the calls coming in every day. As you ring the phone number, you're prompted into a stream depending on your query, and we monitor the shape of those calls over the day and readjust and flex resources. The other thing we have done in yesterday and today is we're actually putting in more agent support. As Liz said earlier, we have 150 different individual scripts for our call agents, and they will need support as well. So we've increased our support to our call agent staff as well as increasing overall numbers. And tomorrow and over the coming weeks, we'll add different channels to allow people engaged with the service as well and meet their needs.
We heard about the updating of information so that the hunting through the system of the problem areas is updated on a 6-hourly basis. And we just heard. Can that be improved? I would think that the 6 hours is about at the outer extremity of the tolerances that would be expected in a situation like that. That 6 hours could come into 12 hours very quickly, depending on what time of the day the update took place. So instead of every 6 hours, can that be done every 3 hours, and would it make an improvement?
Deputy, I'm not quite sure what the reference to the 6 hours is. Could you just say that to me again?
Yeah, one of our guests mentioned the 6 hours updates in 2 minutes ago to the previous.
Barry, was that on your side?
Yeah. Yes, Liz, that was in connection to changes in the public keys where countries maybe changed the QR code or another health authority was added. That's what's updated every 6 hours, but that's not the health advice. Sorry, I was referring to.
No, my query in relation to that, it's updated every 6 hours, but could it be updated every 3 hours? And what would the benefit of an update every 3 hours be? I suspect that it could be quite considerable.
So just to be clear, Deputy, what's being updated is actually the technology keys that go so that the verifiers are reading them accurately. That's not an update for the general public, if you know what I mean. It's the technical.
I accept on that. I understand that. But my question still remains. It's an update every 6 hours. So the problems are the reinterpretation or new interpretation of regulations may or recognition of the harassment updated every 6 hours.
Yeah, you're
improved by updating every 3 hours.
Yeah, you're absolutely right, Deputy, because there's two parts to the process. One part is that you actually recognise the QR code in a country, but the other part is that they update their travel rules. So you're absolutely right in that. What I would say is we're entirely dependent on other countries to go through the process correctly. And in the early days where there's been teething problems, we've found that that's not the case. Without naming specific countries, there's some countries where people were coming in from them and their certificates were not correct, or we could not read them with our verifier app. And when we investigated that, we found that they hadn't engaged with the EU system properly and the error was at their end. So there's a huge dependency on countries to keep the EU interoperability portal current, and there's not a lot Ireland can do other than through our health engagement through the Health Committee is to make that representation, which we can obviously do.
But we can point out to all other countries the helpfulness of accurate and reliable updates. And incidentally, that document that Liz circulated in her opening statement this morning, I think it was 17 pages, a lot of information contained in that, and that doesn't contain all the minutiae that's available and is necessary out there. So my point is, the more broadly available that document is, better for everybody concerned. It'll eliminate a lot of the initial difficulties. And how fast can we gather all the information, all the necessary information in relation to individual countries together in such a way to prevent the kind of things that we heard about in the days.
So we will update. We will be updating the gov.ie/travel, and DFA will be updating their information on their website, and we'll have a look at that again today. We're looking at it constantly to try and put as much information there as we possibly can, but we will review that again today. Thanks, Deputy.
Thank you, Chairman.
Thank you very much. Just a couple of questions myself. I suppose I'm one of those people who name it Irish, on the vaccination. I changed it midstream because that was I realised that that was the direction we were going in. But there's quite a lot of people out there that have been in touch with me over that, over their names being different on their passport and so on. I raised this with ministers, and it was if people were hearing it for the first time, and it's not unusual for Irish people to have a particular different name or a different name on passport or birth cert or wherever else. And part of the difficulty is that people could be three different names in relation to their, and any of them could be on the documentation. But just one of the things I wanted to ask in relation to is the people from the north of Ireland. And there's been questions asked about other jurisdictions and so on. But I'm talking in terms of it could be a person that's from the north of Ireland that got vaccinated in the north but live in the south, or someone from the north who's travelling through Dublin and so on. And now we were told that that they would have their own digital cert and that would suffice. Do we have any more up-to-date information for those people who are travelling? Because many of them do travel through Dublin or Cork or Knock or wherever else in relation. All the they travel around southern airports to get to European destinations. So, is there information for that huge cohort of people who regularly use Irish airports, who are Irish citizens, but may have got their vaccination in the north or likely or somewhere else?
So our understanding of anybody who has been vaccinated in Northern Ireland or Great Britain, that they will have the NHS cert, and it's a digital cert. So that's our understanding, and we would consider that to be of equivalent standard. So that is being accepted. I'll check off the top of my head. I'll check that information is up on the website. But I think we're pretty satisfied that it's pretty clear. There is other issues relating to people who have been partially vaccinated or maybe vaccinated in half in one jurisdiction and half in the other, and that is something we're also looking at. Damien, I don't know if there's anything you can add on that one.
Yeah, Liz, we're accepting basically where someone had their second vaccination in Ireland, we'll issue the digital cert, and that's on the basis that they'll have contacted HSE Live or through their GP, and we'll then have offered that. We'll have evidence of the first vaccination, we'll provide the second vaccination and provide the cert as normal. If someone had a first vaccination in Ireland and gets the second vaccination in another member state, we would expect that member state then to treat that in the same way.
Yeah.
Okay.
Thanks, Damien.
That's great. It's reported airlines are not checking for PCR antigen tests. Have you been made aware of this, and what are you doing to address this? The system operates effectively and people have confidence in it. Again, these would have been some of the reports that people travelling through travelling aboard, that there was no one checking their for a PCR or for the digital cert on the Irish side.
So is this on arrival you're talking about?
No, I'm talking about on the people. Well, people travelling out. People travelling out of Ireland. Again, we've seen the difficulties in relation to the Malta situation. Again, mixed information in relation to that. So, it would be, I imagine, a lot better for people if everything was checked on the Irish side before you actually land in another country and you're faced with all those difficulties. Yeah, so just to be clear, almost all countries are operating the same way, is that the carriers are checking at the point of departure. So what carriers are doing is what the other countries have asked them to do in terms of their point of destination. What we can tell you is what we have asked the carriers to do here in terms of anyone travelling into Ireland. So Fintan, would you maybe just give an update on what we've been talking to carriers and what they're checking for us? And just to say, maybe after that, Maurice, you might say a little bit about the enhanced PLF, which will assist carriers further in filtering the ones they need to see the test results for. But go ahead, Fintan.
Okay, thank you, Liz. Thanks, Chairman, and good morning, everybody. So yes, I mean, carriers for several months now have been implementing certain checks at the point of boarding in order to safeguard public health requirements. So I suppose the first issue that the carriers address is in terms of the online check-in. They require travelling passengers to confirm a checklist, basically in terms of not having symptoms of COVID or not, and being aware of the requirements in terms of travel. At the point of boarding, all carriers are checking that travellers have evidence that they have completed the passenger locator form, and they are also checking that there is evidence that a person has a negative PCR test, which is the primary public health control that we have been implementing now for some time. Of course, the new requirements in relation to travel that have been applied since Monday mean that persons who are vaccinated or who have recovered and have certification of that through a digital COVID certificate don't require a negative PCR test. And what we are doing now is we're expanding the passenger locator form to capture passenger declarations according to the specificity of the health status under which they're travelling, which could include a digital COVID certificate, other evidence of vaccination that's acceptable, evidence of recovery, etc. And the airlines will continue, airlines and ferries will continue to check at the point of departure that those declarations have been made, and where applicable, they will continue to check evidence of negative PCR tests.
And just the cert that's being sent out, or being emailed or posted out, what is the system there? Is it the length of time that's since someone got the second vaccine, or or is it what is the system you're actually using? Because some people are saying that they were only vaccinated a week ago and they've got the cert, and there's others that a number of weeks ago, or over a month ago, or longer even, and they've had nothing in the post or nothing. So what is the actual system we're using?
So essentially, Deputy, I suppose to start with, we effectively had a massive backlog, shall we say, of everybody that we had information on. So some of the people who maybe were vaccinated earlier that didn't receive their cert yet may either have been a bounce back, an incorrect postal address. That's more likely. And then there's a small number of remaining that I'll let Damien talk about in a minute. So they may be in that category. But what we're doing now is, once a person receives their second vaccination, that data is being updated, and that data file is being made available for the purposes of generating the certs. So on an ongoing basis now, we are releasing that information once the second vaccine has been administered. And that's, so people are seeing quite a reasonably quick turnaround once that data gets into the OGCIO system. So that's where we're at on that. In relation to recovery, you're not eligible for a recovery cert until 11 days after your test. But once you've achieved that, you can then apply and you'll be eligible, and that'll be valid for 180 days. But Damien, do you want to say a little bit about the other remaining certs we haven't been able to issue yet?
Sure, Liz. So maybe just two key points, Chair. One is that there is a process for all of those that have been vaccinated every day. Now, obviously, we have new people getting their second dose, and as Liz said, it's a record of the medical event. So we turn those around into Barry's team, and those people will get their certs. And there's a process there then in terms of any rebounds, be they email or letters, which can be dealt with from there. So hopefully as we get over this initial hump, that will be much smoother for people in terms of the time frame. And if you take it that most EU member states are insisting that people wait that period, be it 14 days before using it, that shouldn't present any issues on an ongoing basis. On the certs then that we're still working on, so we still have a small proportion, particularly going back to the very early days of the programme when there was pressure in hospitals, long-term care, healthcare workers and so on, and where minimal information maybe was provided or incorrect data maybe there that we're working through. Probably what we've left now is in around about 150,000 of those that we're working through. We have a team, and that's reducing every day. That would have been a much larger number at the start. So we take the data from GPs, pharmacies, the ambulance service, community vaccination teams. The public portal is much easier, Deputy, because we have a verified email address. Now, we still do get some rebounds from that, maybe where people have changed or whatever, but in the main, that's quite a reliable pathway. So it's the other pathways are more complex. Obviously, it relies on information that's collected at the point of vaccination. And clearly, when the process started, there wasn't, there was no minimum data set required, for example, for the digital cert when the vaccination programme commenced in January this year. So we're working through those, Deputy, and we're getting through them fairly quickly. And there are some complex cases in there in terms of names and so on, and in terms of addresses and other information. And we have teams working to try and validate that, linking up with GPs, linking up with hospitals, linking up with long-term care and other settings like that. So I think, as was said earlier, there's nearly 2.2 million now issued, and there certainly will be through today. So, the vast majority of those are out. We'll deal with those that come back through the post and email, as Barry has described. And then we're still working through the final group I suppose, where there are issues in terms of the data that's collected around those, Chair. So that might be the reason why, as you say, one person hasn't got it who was vaccinated 4 or 6 weeks ago, and someone who's vaccinated in the last 4 or 5 days perhaps would have got their cert. So that's the sort of mix. But once we get over this hump, there's a smoother process there, Chair, that will allow that to run on an ongoing daily basis in terms of production of certs. And as I say, given the requirement for that sort of vaccination period after the vaccine to be extended, that won't present any issues for people. So this is just a critical phase to get through at the moment.
Okay, and just, it's already been asked by one of the members that there be a dedicated line, but you might consider that to be an email maybe for elected reps again, that, because of the volume of cases that we're getting as well. We do have an issue in relation to people with literacy skills and so on, and difficulties with using the IT system and so on. So people do go to elected reps or go to others, and it'd be really useful if there was some sort of hotline or some way of people making those reps. There's a couple of our members looking to go back in. Roisin Shortall and David Cullinan have indicated there. Roisin.
Yeah, and just 2 very quick questions. Following on the last one there, I've had a few complaints from people who are in their 70s who would have been vaccinated by GPs at an early enough stage, and it would seem to be a straightforward case. And they haven't received their certificates yet. Is there an issue with GPs at all? I'm just wondering why that would be the case, why they wouldn't have got their certs yet.
Not necessarily globally with GPs, Deputy, but there could be, say, where some of the details perhaps that are there around the addresses. So one of the things we did is we parsed all the addresses to see, did we have a number of lines, did we have an air code, and we released it where we had one address line and an air code. But we did have examples. You can understand yourself, say if you're living in Santry, someone might know that, I don't know, Main Street, just keep it very simple, is the only line. They'll know where that person is, but in terms of feeding through to our system, obviously that wouldn't then get sent. So they're the type of small examples that we're working through to try and get those closed off. So people will get their certs. If there's an immediate requirement, as Liz and others have said, they can contact the helpline. If not, we're still working those through and just be assured they will get them in terms of that process that we're going through around the date. And we have a team who are linking back with GPs to verify that, to make sure that the information is accurate where we feel perhaps it isn't comprehensive, or where it comes back around, Deputy, into the call centre in relation to where, it hasn't, the postal address hasn't been sufficient or the email address isn't sufficient. We did use some email addresses as well from GPs, Deputy, just to try and accelerate it. We knew there was a slight risk there that some of those would come back, and then those will be posted, or we would go and try and find a postal address if there's none there by working with the GPs on that.
Okay, that's new information, because I think most people that had the vaccines with the GP expected to get letters. That's what they were being told initially. Yeah, but they're saying that some of those will get emails instead.
Yeah, if there was one provided, Deputy, the vast majority, though, I would say to you, are postal. As a general rule, the GP addresses in the main are postal, but there would have been a small proportion where an email address might have been provided, and we would have used that when we felt it was safe to do.
It's just important that people know that in view of the danger of going into spam. They should protect that. Just one other point I just wanted to raise with Liz. Liz, it's been reported that in the case of hospitality, that the DCC on its own may not be sufficient, and that consideration is being given to requiring people to produce ID along with the DCC for that purpose. Could you comment on that, please?
I'm not up to speed on exactly what discussions are going on at the moment. So those discussions were going on with hospitality and the relevant departments. So when they conclude, we will have to look at what the regulations, and that'll be a matter for the Department of Health to do the regulations. So that's all still in play as I understand it, and I don't have any further information at this stage on that.
And when would you expect these issues to be clarified, given that hospitality is due to open on Monday?
Well, again, we're waiting on government decision in relation to all of that, the timing, and obviously the bill hasn't yet been signed by the President. So I can't really give you any further update at this stage.
Thank you.
David Cullinan.
Thank you, Gail. Yeah, just to follow on that point. So all of our questions today were in relation to travel, but as we know, this sort will be used for domestic purposes, and a lot of the details of that are still being finalised, and yet it's going to come into operation on Monday. Can I ask through yourself, Gail, that a briefing would be given to members of the Health Committee if they so choose on that issue, because there is going to be a lot of issues in relation to how this is going to work. And we had a briefing a number of weeks ago, but now there has been changes to it in relation to guidelines that have been agreed, it seems, with the industry and so on, and then how the app is going to be used. All those questions are going to be reasonable questions that we have. So I'd ask, first of all, that if that was possible, that a briefing would be arranged for us. Can I just come back to two quick issues, Elizabeth, if I can? And the first is in relation to the issuing of the DCCs for people who are Irish citizens, but they live abroad, and also, of course, people who are Irish citizens who live in the north. So I hear what you're saying, that a citizen who lives in the north and has an Irish passport will get an NHS vaccine proof. But that doesn't answer the question in relation to, can they avail of a DCC here? Is that possible? Because I'm just reading from the EU website where it says EU citizens who are vaccinated in a non-EU country can request the EU digital COVID certificate from the member state of their nationality or residence. The EU digital COVID certificate will be issued if there is a proof of vaccination and if the structure of the health system allows for it. So, first of all, is that possible here for citizens in the north? And then what's going to be possible for people outside the state? And then just very quickly to come back to another point that I made earlier, because I think it's important to make this point, and it's not a criticism of any of the officials who are doing their best. But you answered questions earlier in relation to advice for people that travel, and you gave very good advice that people should check the website and check the travel advisory criteria for whatever country they're travelling to. And you made the point that this is complex and that while there is a DC system in place which should not prevent you from travelling, each member state will have its own criteria for at points of entry. So I'm going back to the messaging from government, and not necessarily just the tweet that we talked about earlier. The message, if you read that, seemed to suggest that if you don't have a DCC, you'll be okay if you have your vaccine card. And that's, to me, incredibly risky for people to take that advice and to travel. So is it your view, again, to be very clear, that people really should go onto the website, look at the travel advisory criteria for the country that they're travelling to, and not take it for granted that the vaccine card will be accepted? Is that your advice? Is that the advice from the department? I'll leave it at that. Thank you, Carol.
So, Deputy, just in relation to your first point, you'll have heard Damien in terms of what we are doing in relation to people who are vaccinated, maybe between the two jurisdictions, so that the possibility of issuing certs is there. We haven't put in train yet an option in relation to citizens residing elsewhere. We just haven't got to it. I guess from a sort of a logical point of view, we're conscious that a vaccination is actually a medical event, and the people who can certify that medical event is the state within which it occurred. But we haven't had a chance to look yet at the possibility of issuing certs to Irish citizens where we can verify that event happened in another state, and we intend to look at that. We just haven't got to it yet, so just to be clear on that.
Okay, just get clarification, Elizabeth, that what I said earlier in terms of the criteria that's on the European website itself, the official European website, is saying that if you are an EU citizen who is vaccinated in a non-EU country, that you should be able to request an EU digital COVID certificate in the member state of which you are a citizen. So that's what Europe is saying. We just haven't got around to it.
That's our intention. That is our intention. We haven't got to it yet.
To do it at some point.
Yeah, it is something we've said we are going to look at further in the context of the European regs. Absolutely. In relation to the second point, yes, what I said earlier is people need to be very clear. This is complicated. So on the one hand, there's a standard of proof that a country might require, which is what the Malta case problem is. And the second thing is, what are the rules when you arrive, depending on what your status is? So they're two different things, and people just really need to be clear in their minds what the requirements might be, whether you're vaccinated, recovered, or or test result. That's the first question you have to ask yourself. And second of all, you have to look to see what proof does the country require of those things. And in some countries, they don't accept test results. They only let you in without quarantine rules. If you're vaccinated, they don't accept recovery. So that's the first thing you have to establish. And the second thing you have to establish is, if you're relying on one of those things, what's the standard of proof? And that's all there on that EU Reopen website. It's very helpful. So that's my best advice to people.
Thank you for that.
Well, thanks very much. I think it was really helpful. There's a lot of information that was, given out here today, and I suppose the message, if we have any message at all, if people are thinking of travel, that please don't think twice about travelling without the DCC cert. You can travel, but you may be quarantined, I think, is the subliminal message that we need to send out to people. So I think it was really useful information. There is a request there, for additional information as this rolls out. I think today we've touched on some of the issues, but it's unfolding, as you all admit yourselves. Part of the difficulty is that it's across a number of the departments. And even going to ministers was giving us different information who was in charge. The Department of Taoiseach, it was digital, it was health, it was travel, and so on. So maybe, again, collectively, if you could, come up with a briefing for elected representatives, not necessarily the Health Committee, but, I think it would be really useful before, as soon as things clarify, you have some sort of clarity in relation to what's going to happen, particularly around the indoor dining and so on. But I still think there's going to be a lot of questions about people, possibly travelling and so on. There's demand is there. You've seen the amount of phone calls. Any criticisms is not of yourselves. I think it's, I think we could be critical of government in relation to the way this is, who's in charge, how it's rolling out. But at the end of the day, I think it was really useful information they departed this morning. So that concludes our meeting and our business for today. The meeting now stands adjourned until we meet again in public session when it all resumes after the summer recess. And again, I wish you all a happy summer and a safe summer. Good morning.
Thank you.
Islam.